Hi, I'm Lisa Tyler. I'm the Communications Director for Senior Resources of West Michigan and Area Agency on Aging.
Hi, I'm Andrea Douglas, and I'm the Options Counselor Supervisor.
So Andrea, what exactly is an options counselor?
An options counselor is somebody that is specialized and trained in long-term care options. So when someone calls or comes in, they're going to be connected with an options counselor that can talk to them about all their different long-term care options in the community, whether it's senior resources programs or other programs that are available out in the community.
So somebody can call at 231-733-3585 to call an options counselor. What kind of information are they going to get?
So our options counselors are available, like you said, at 231-733-3585. They're available Monday through Friday from 8 a.m. to 4 p.m. About 90% of what they do is on the phone. However, they do take walk-ins here at 560 Seminole Road at Tanglewood Park. They can handle walk-ins, so where if someone comes in and just has some questions, they can meet with them. Someone can call that number, schedule an appointment, and meet with an options counselor. They can even do family meetings out in the home. So if a person really wants to get more information, but it's really difficult for them to talk on the phone, they can ask an options counselor to come out to the house. They'll set up an appointment, and then they'll come out into our 3-county area, either Muskegon, Ottawa, or Oceana, and they'll meet with them and their family and do like a family meeting or just a meeting one-on-one with the person.
So when they call an options counselor or you do an in-person visit, what kind of questions, what kind of resources are you talking to them about?
All right. So when someone calls into the options line, they're going to be connected with an options counselor that can talk to them about all different types of long-term care options in home and out of home. They're going to talk to them about services in the home, which could be anything from needing respite for a caregiver to needing a personal emergency response button to personal care to homemaking. Those types of services in the home. They can go all the way to different types of services out of home, like we can give information on assisted livings and nursing homes in the area. They can talk to them about our programs through Senior Resources, our case coordination and support, our My Choice Medicaid waiver program that we administer. But we can also talk about other programs not through Senior Resources, like VA or the Life Circles PACE program, or programs through the Department of Health and Human Services. They're really going to touch on any program that can help with services in the community, keep them safe, keep them independent in the community as long as possible.
So what kind of financial resources? Do they have to divulge information about financial resources when they call to qualify for programs?
Sure. So usually when someone calls in, it's either the person themselves looking for resources for themselves, or more typical, it's a family member. So they're usually calling in for, say, mom or dad or grandma or grandpa. They're really looking for all different types of resources. So we're going to go through all those different resources in the community, and we can really try to highlight the different eligibility that the programs have. So if a person really needs help in the home, let's talk about what your resources are. If a person has the ability to pay for resources, then we can point them in the direction of different agencies that can provide those resources for what they can pay. If the person really doesn't have the resources to pay, then we can talk about different programs that are maybe funded through grant or Medicaid that can help provide those resources. When it's a family member calling and they're usually calling saying, I need help for mom or dad. It could be anything from mom's having issues with falling and she's not eating right. So let's talk about that. What can we do to help it make it so she can stay safe and in her home? So maybe we can talk about the Age Well's Meals on Wheels program to help get her a more balanced, nutritious diet. Let's talk about if she's safe with falls, we have a Matter of a Balance class that we offer here. So maybe that's something we can refer them to so that they can hopefully become more stable and safe in their home. Let's talk about personal emergency response systems so that they can have a button. If they're living alone, sometimes that is one of the cheapest and safest things that somebody can get to keep them at home. If they're at fall risk, that button is a lifeline where they can push it and be connected with somebody. If they've fallen, if there's an emergency of any kind, they can push that, get connected, get the help that they need, and hopefully the quicker they get help, the better the chances of staying in the home. So our options counselors will go through all of these different things. A person calls in, they present their unique life situation. We're going to try to connect them to whatever resources are going to meet that need.
So it really is, as we say in our marketing materials, tell us your story. We're here to help.
Tell us your story. We're here to help. We'll go through everything with you. We'll talk about what resources. We do talk about the finances and the medical criteria. Every program is a little different. So we're really going to get into your medical need, your financial resources. How can we help you pair what your resources are up to meet your need? So if you really don't have a lot of resources, let's look at programs that can maybe help with the financial side. If you do have resources, then let's look at different programs or different agencies that can meet that need. So we're going to be looking at all different resources, not just our programs. It's going to be any program. And our options counselors are trained in learning about the different services that are available out in the community. When they first hire in, they are going out and doing touring. They're going to go to like an adult day center and learn what does it look like. So when someone calls in, they can speak intelligently about different places out there. So if they can say, I have been to this adult day center. This is the type of things that they can offer, the type of program that they have and services they can offer. They tour assisted living, so they have more of a working knowledge of what assisted livings look like and what kind of things that they can offer. Same with skilled nursing. So they're out in their training doing these tours to learn more about all the different resources. And we are constantly having staff trainings and people coming into our meetings to talk about different resources in the community so that we really are well versed and can give good information.
That's great information for people. I know there is not a typical caller, but can you, without divulging personal information, maybe share what a phone call might be? Because rather than, they're not usually calling for 6 different things. Give us an idea of somebody maybe who's calling for a parent.
So if someone calls in, it usually is in crisis mode. It's better if you can pre-plan. If you want to just kind of know what's out there, that makes it a lot easier for a person to be able to plan out, okay, right now mom's safe, but we know down the road she's probably going to need some help. What's out there? That's a great time to start looking at advanced directives, making sure those things are in place while mom still is healthy so that that's ready to go if things do take a sudden change, which is usually what happens. Is it's something sudden that happens and now we need help now. So the more information you have in advance, the better. But when they do call and they need help now, it's really kind of trying to narrow in on what kind of help are they looking for? What programs can meet that need? So mom just came back from a hospitalization. She fell, broke a hip, something along those lines. What can you offer? So we're going to talk, okay, what are her needs? That's going to be the biggest question back to somebody is, what do you think or what does she think her needs are? So, okay, she's back at home now. She's struggling to get her laundry done. She really can't get out to the grocery store. Really maybe having issues with taking her medications appropriately. Something along those lines. That's where we're going to be looking at, okay, so you're telling me these are the things that she is struggling with the most. Let's figure out what program can help with that. And if she has the resources available to her to maybe pay for some of these services, then let's talk about what agencies can help do those services. It's really looking at the different resources available out in the community that can help meet that need and then plugging those services in for them. So the options counselors are really trying to help them develop a plan. There's nothing more satisfying than as an options counselor than when someone comes in and they are completely frazzled. They don't know where to begin. I need help for myself or my mom or whoever, a family member. There's nothing more satisfying than being able to sit down and say, okay, what's going on? What kind of help do you need? Let's figure it out together. Let's go through everything, all of our different resources out there. And it can be a little overwhelming. So we try to really narrow in on what someone qualifies for. Instead of just giving a ton of information, let's focus in on what the needs are and then narrow it from there. So there's nothing more satisfying than going through all of that with the person. Even if there's nothing immediate, a person really has that sense of relief when they walk out of, okay, I might not get what I want right this minute, but at least I have a plan. I know my next step. And that's really what the options counselors are looking to do, is come up with that next step, walk with the family through the process so that they get the help that they need.
And so that was a great way to say options counselors don't begin and end everything. They begin it and then they might give a great informed handoff to a supports coordinator, or a social worker, a case manager kind of person.
Right. They're going to be the ones that do the intake portion. They have really two roles. They're going to be doing the options counseling piece, which is with the family or the person themselves, and going through and saying, okay, we're starting it all out. Let's come up with a plan. If it is like one of our internal senior resources programs, they will then go into the intake piece where they will be filling out the paperwork. They'll be making the referral, getting a person on a wait list if that's what's necessary. They're going to do all of that. They plug all of this information in so that the next person that touches it will hopefully have a really clear picture of what the needs are. So hopefully it can move things along smoother.
Perfect. So they're not having to repeat all of that information because it's in our computer database. And then the next person who actually takes them through the process has the information to start with, and smooth transition there.
That is the hope, that they will have all this information and have a story, basically having the person's story available so that when they do come out to do an assessment, they already kind of know going in what the needs are. Things could possibly change, and certainly the more information will be gathered at an assessment, but at least they have the basics to get started and hopefully streamline the process.
Great. Let's talk just briefly about our Options for Long-Term Care booklet.
So Senior Resources has a booklet that we put together every year. It is our Options for Long-Term Care booklet. It's available on our website at www.seniorresourceswmi.org. You can actually download a copy for yourself. We do have some hard copies available, and when someone comes in, usually for like a walk-in, those are where we usually give them out. But the booklet really highlights a lot of the different resources we talked about. It has everything in there from Medicare information to Medicaid information and eligibility to our My Choice Medicaid waiver. It talks about VA, Life Circles PACE, Department of Health and Human Services, the Age Well programs, which is the Meals on Wheels, their congregate meal sites, and their senior center here. It really highlights a lot. It's not all inclusive, but it really highlights a lot of the major referrals that we make on a day-to-day basis. And it's a good starting point or jumping off point for families to start the process, to get more information and be more informed so they can make the right decisions for what programs they are good for their loved one or for themselves. If you're looking for any long-term care options for you or your loved one, please call our Senior Resources Options Counselors at 231-733-3585, Monday through Friday, 8 a.m. to 4 p.m.